Hello and welcome to Health Talk, where all we do is talk health, giving you health information that make you live a more healthier life. My name is Oluwatoyin Agbo. On the program this morning, we'll be looking at a new innovation in the healthcare delivery. It's called regenerative medicine. And I have with me Dr. David Ikudaisi to educate us more on this issue. You're welcome on the program.
Thank you.
So what exactly is regenerative medicine?
Regenerative medicine is a branch of translational research in tissue engineering and molecular biology. Regenerative medicine technically includes using patient's own blood, which we refer to as platelet-rich plasma therapy, and also adult stem cell therapy. Adult stem cell therapy can be a way of using patient's bone marrow or patient's own adipose, which is also known as fat, to help to repair the body or restore the body's normal functioning.
For how long has this method been in use?
Well, some part of the regenerative medicine has been in use for many years. For example, treatment of leukemia with the use of bone marrow is a well-known, well-practiced mode of medicine. But the other application of platelet-rich plasma or other type of adult stem cell therapy are relatively new, less than 10 years. For example, it's very common in US for the orthopedics to be using PRP or bone marrow to accelerate the healing process of their patients after surgery.
What has been the success rate of regenerative medicine since you've been practicing it?
Yes, for all the current applicable areas, we've had good success rate. Likewise, my other colleagues that are using regenerative medicine, because there's really no side effect, if any, very minimal, for the simple fact that we are using the patient's own body part, which we refer in medicine as autologous. So the risk of rejection, risk of failure is very almost not available. And if this is being done under a good sterile or aseptical condition, then the risk of infection is almost minimal.
I haven't known this fact about regenerative medicine. How can regenerative medicine be useful in the treatment of infertility in women?
That's an interesting area. The use of stem cell therapy for infertility is still at the early stage. Research has been done on animals whereby the bone marrow tissue, after it has been processed, of course, is being injected into the ovaries, and they found out that the new eggs that were produced are even healthier than prior to the chemotherapy condition that the animal specimen went through. So based on that, they plan to move to human studies. And once that is completed, it's going to be a new way of providing solutions for women with an infertility problem. And men likewise too. There's a study going on.
So what parts of the human body will be used for those treatments?
There are two sources of the adult stem cell therapy. It's either the fat or the bone marrow. It has been found that fat or adipose tissue has 500 times more stem cells than bone marrow. So if fat is processed in the right way and given to the patient, it will be delivered intravenous. And as of today, since the human studies have not been completed for direct injection to the ovaries, the only way a woman trying to go through IVF or somebody who has failed a couple of IVF trials in the past, the only way they can increase their success rate is getting intravenous adipose stem cells, whereby we are hoping that the stem cell will eventually reach both the uterus and the ovary to rejuvenate and regenerate those tissue organs and organs.
You know, in Africa, especially in Nigeria, many people want good health, but are constrained because of funds. How affordable is regenerative medicine?
Using stem cell now for infertility is expensive. It's not something that everyone in Africa with the problem can afford, unfortunately. But I believe that down the road, just like any other medications, it will be something that is reachable for the mainstream, you know.
You mentioned earlier that the research is still on using regenerative medicine on infertility. What if someone feels that I don't want to wait for the research to be concluded? Are there other ways to use regenerative medicine in treatment of infertility?
Yes, for those who cannot wait for the conclusion of the human studies and they're concerned about their infertility, another way adult adipose stem cell can be used is by delivering the processed or digested fat directly into the arteries that feed the ovaries and the arteries that feed the uterus. So that way, the stem cell will have a first bypass through those organs before the other part of the body start taking up the stem cells. So that way, the chances of getting results will be high without waiting for opportunity to inject directly into the ovaries, which was what the studies was done about in animal studies.
Thank you very much for being part of the program this morning. And I will call you again because we still have lots of topics we want to treat using regenerative medicine.
No problem, I'll surely be waiting. Thank you very much.
Well, that was Dr. David Ikudaisi, and has indeed been educating us on what regenerative health medicine is all about. That's the program this morning. Join me again next time. My name is Oluwatoyin Abo. Bye for now.